Oftentimes, patients mix up ovarian cyst and polycystic ovary problems together and can take wrong decisions about their health. Actually, ovarian cysts and polycystic ovaries are very different. Sound similar, but completely different. Right information is crucial in such situations. For ease of understanding, we will discuss this in 4 parts. How their origins differ, how the symptoms differ, how do the treatments vary between these 2 conditions, and perhaps the most important, what precautions should you take specifically for each one. In these 4 parts, you will understand how different these 2 conditions are and why you need to be aware of them. Before we start, let's be clear that the cysts we will discuss here are the cysts before menopause. Postmenopausal ovarian cyst treatment is completely different. Let's keep that for another time. What causes them to happen? First, ovarian cyst. Ovarian cysts are very common. 1 in 10 women will be diagnosed with an ovarian cyst in their lifetime. Because ovarian cysts may stay silent, it is estimated that many more women live with ovarian cysts. She just doesn't know it. The word cyst in the Greek means fluid-filled packet. Sometimes fluid accumulates in the ovary within packet. Its name is ovarian cyst. The ovary is a very active organ. Ovaries talk to hormones every month, and every month an astonishing factory inside the ovary brings out 1 egg. Every month when this egg is released, a small cyst is formed in a healthy ovary. As the name of a small cow is not a cow, it is calf. Similarly, the name of this small cyst is different. Not a cyst, this is called follicle. Since this type of cyst occurs when the normal ovary functions normally, it is also called a functional cyst. These cysts come and go. Other than ultrasound monitoring, no treatment is usually required. Sometimes this type of cyst becomes very large. Science doesn't know exactly why they grow. They need treatment. Of course, they don't develop overnight. Sometimes it is too late when the patient finds it because it does not show symptoms at first. Everyone gets surprised when it is discovered. I will talk more about this when I talk about precautions. There is also another type of cyst called endometrial cyst. This type of cyst is caused by the accumulation of period blood within the ovary. Another type of cyst is called a dermoid cyst. It's rather strange. The woman with dermoid cyst has some trapped tissue from her early weeks of her life in her own ovary, from the days when she was in her own mother's womb. In adulthood, that captivated tissue grows. Its name is dermoid cyst. It often contains teeth, hair, nails, thyroid gland, eyes, sweat glands, and may look like an incomplete baby. Corpus luteal cyst. During the first few weeks of pregnancy, the baby needs a type of hormone known as progesterone from the ovaries. Therefore, in anticipation of the pregnancy, the progesterone factory in the ovary becomes large and often creates something called corpus luteal cyst. There are some other rare varieties of ovarian cysts that can be discussed later someday. What causes polycystic ovary? Ovaries sometimes stop releasing eggs because of certain hormonal imbalances. These small eggs, those cannot be released, accumulate like water drop under the skin of the ovary. With ultrasound, it looks like a pearl necklace. Its name is polycystic ovary. Poly means a lot, and in this case, cystic means an egg trapped within the ovary in the form of small water-filled blisters. In the polycystic ovary, the ovary becomes slightly swollen but does not change its shape. Maybe that's why polycystic ovaries are not supposed to cause abdominal pain. Abdominal pain in polycystic ovaries should prompt investigation to check other hidden causes of pain. Coming to the difference between symptoms of ovarian cyst and polycystic ovary. Ovarian cyst symptoms. I will repeat what I always say. The absence of symptoms does not mean that there is no problems within the ovaries. Ovaries is one special organ of the body where severity and complexity of the problem does not match the external symptoms. Many times, ovarian cysts may remain without symptoms. Even large cysts or even cancer almost stay deceptively silent over many months or years. Usually, abdominal ultrasound, period problems, abdominal swelling, etc. prompts an ultrasound scan and a cyst is discovered. Sometimes, ultrasound is done to investigate pain during intercourse. and a cyst is discovered. Occasionally, sudden vomiting, gas, or severe abdominal pain could be the symptoms of ovarian cyst. The medical name of such abdominal pain is called acute abdomen. If the cyst suddenly expands, a blood vessel may get stretched and bleed. The cyst may twist on its own stalk. It is called torsion. Here, a sudden sharp pain may be experienced. Sometimes, the cause of sudden symptoms is internal bleeding in an ovarian cyst. All these are termed as ovarian accidents because such symptoms are so sudden. Cyst problems may manifest with completely non-gynecological problems like urinary or bowel problems even. Next up, symptoms of polycystic ovary. Usually seen in young adults, polycystic ovaries are detected on ultrasound during investigation for irregular periods, scanty periods or weight gain, or unwanted hair growth on the face, chest or back, or sudden hair loss from the head. All these can be controlled successfully. By the way, polycystic ovary and polycystic ovarian syndromes are two different things. Having polycystic ovary may not mean she has got polycystic ovarian syndrome. That could be a topic from another day, not today. Treatment. The treatment of ovarian cyst and polycystic ovary is completely different. First, treatment of polycystic ovary. Science is yet to find a cure for polycystic ovary because the problem lies deep within the gene in the insulin receptor protein. A lot of complex words, right? So far, medicines cannot adjust our genes. Most of the drugs that are given for polycystic ovaries control symptoms and make us forget about polycystic ovaries. Polycystic ovaries respond very well to lifestyle changes such as proper diet and exercise rather than medication. So, it is better not to take medicine unless it is very necessary. Consult the doctor. Don't forget to pay attention to the cautionary advice at the end of our discussion. I will tell you about the minimum treatment requirement for polycystic ovary. That is important. Treatment of ovarian cysts. The main mantra of this treatment is to find if the cyst is reported as simple cyst or complex cyst on ultrasound. In complex cysts, the ovary may contain structures other than liquid. Complex cysts are more likely to develop cancer in the future. So, the treatment of complex cyst is completely different. If the ovarian cyst contains only water or liquid, it is called a simple cyst. Most simple cysts resolved without any treatment, especially simple cysts which are less than 4 cm in size. Such simple cysts can be cured naturally by body's own hormone cycle, or if we give the rest to the ovaries from monthly egg production using some tablets. We just need ultrasound monitoring to check if it has resolved in few weeks. Ovarian cysts that are over 5 to 6 centimeters in diameter are unlikely to disappear on their own. Larger cysts are more likely to cause more cyst accidents, sudden bleeding into the cyst or twisting of the cyst or torsion, or sudden enlargement of the cyst. So it needs treatment. That treatment is often a surgery. Not only it treats but also takes out the tissues for microscope confirmation of exact problem. All the cysts we have discussed here today are cysts before menopause. Postmenopausal cysts are all abnormal. That is because the ovaries are no longer supposed to function after menopause. However, postmenopausal cyst abnormalities do not always mean that those are cancer. Any activity in the ovary after menopause need to be closely monitored. Postmenopausal cysts are a whole different science. We will discuss that in a different video. Precautions, very important. Precautions of ovarian cysts first. 3 types of cysts need extra attention. Cysts larger than 5 cm, cysts which are diagnosed as complex cysts, and cysts that are asymptomatic require extra attention. Why? Because these type of cysts can take a different turn in future. Learn to recognize these terms typed on your ultrasound scan report. Septum, multiseptate, multilocular, solidaria, papillary projection, heterogeneous, irregular cysts, increased blood flow inside the cyst, etc. Quite a mouthful. Such characters in the cyst will elevate the cyst into high-risk groups as per 2018 ORAD system, and you will need different treatment. The ORAD system on ultrasound classifies ovarian cysts at 6 different levels from 0 to 5. Ovarian cysts with an ORAD score of 3 or higher require some blood tests and gynecological oncologists should be consulted. This does not mean that every such cyst is cancerous, but in the future, if such cysts are treated like a simple cyst, then you may miss important diagnosis. If you have got fluid inside your belly and ovarian cysts, it is time to see a gynecological oncologist. Even cancer-type ovarian cysts are notorious to develop without noticeable symptoms. So never rely on symptoms only. 3 types of minimum precautions should be taken in cases of polycystic ovary. 1. Having at least 3 to 4 periods per year. If not, the inner lining of the uterus becomes unnecessarily thick, leading to precancer to uterine cancer in early young ages. Public awareness about this is very low, so be careful. If periods do not occur on its own, it is necessary to trigger menstruation with mild medication from doctor so that the inner lining of the uterus or endometrium gets time to shed out. 2. Those with polycystic ovaries are more prone to diabetes and cholesterol problems in the future. So, monitor it by doing little blood tests every year. 3. If you snore, it could be a spectrum of sleep apnea in polycystic ovaries. In PCOS, the back of palate becomes very heavy. Breathing and oxygen supply during sleep gets hampered. A chronic problem. Take care of it. Before we end today, I must mention that any good gynecological health requires investment in proper diet, regular exercise and awareness so that you can experience pure joy and live a long, fear-free life. That's all today. Have a good time. See you soon.